lower back pain and pregnancy. Unfortunately, the two tend to go hand in hand, but there is a lot that you can do to help just relieve some of that pressure on your lower back. And that's what I'm going to show you today. Just a few simple exercises. I'm Karen. I've been teaching pre and postnatal Pilates and exercise for well over 15 years now. I've seen hundreds of women, had 2 pregnancies of my own. So all the stuff I'm going to share with you is tried and tested, but also based on all the evidence and the stuff that you know is going to be really good for you to do. So if you want to join me on your mat now, I tend to do as much work as I can on backs and pelvises here, on hands and knees. And if this isn't your first baby, you'll know that this position is often one of the most comfortable during labour because it relieves the pressure off the tail and the pelvis, and it relieves that pressure off your back as well. This also happens to be a really good position for pregnancy because it's going to help that baby drop down. It's going to help with that positioning of baby ready for a really kind of comfortable birth, or at least the most efficient birth that we can get, should we say. So we're on our hands and knees and we're going to just circle the back round. Now I would say at this point, actually, if you're suffering with any kind of pelvis pain, and there is a video on pelvis pain that I can share with you if you just click on the link above, then you might find that with those knees wide, it's uncomfortable. So I would always suggest just popping maybe a cushion between your thighs so you've got something to hold on to. And then we're going to come round the other way. And why I'm not starting with a straight cat stretch where you round the lower back is, can you see as I'm doing this, my back's naturally moving side to side, forwards and backwards anyway, and it's going to create that movement. Then from here we'll come into that cat stretch, but I want you to feel your tail comes down, your head comes down, the ribs lift up. And then we'll just drop the back down to the floor, but not just there, open up through those ribs. We want to get some extension as well. So we press into your hands, round that back, and then we'll come forwards again, just gently opening up. And you can add a nice breath to this. Just come on in, breathe out as you round your back. And then just let those ribs come forwards. Now from here, from this position, I'm going to show you a little twist now. So just bring your arm underneath you. Now, if you find there's too much baby in the way here, maybe just reach your hand across. You don't have to come all the way down to the floor. That's going to give you enough twist to just feel that around the middle of the back. And the reason I'm doing this is because if you want to relieve tightness or stiffness in a joint, it's good to move it, not just in the position that you would automatically move it, but think about, okay, which way does my joint want to move? Well, the spine wants to twist. It doesn't just come forwards and backwards. I use the analogy of if you had a garden hose and it was kinked, how would you unkink it? You would wiggle it around, and that's what we're going to do with your back. And then come back to me. Now, from here, talking of different positions, I want us to come over onto the side now. So what we're going to do is just come on down. Now, during pregnancy, we want stability. So I'm going to keep hand, knee and foot down on the floor and open up to the side. So just open up through the hip. And if it feels comfortable for you, bring your arm up and overhead as well. So you stretch out here. And then we'll come back down, over to the other side. So again, knee, foot, hand firmly down. And if it feels comfortable for you, we're going to bring this arm up. But again, any issues around the pelvis, that might not feel so comfortable. So you might want to leave those side bends until we're down on the floor, which is what we're going to do now. So I'm going to come on down onto the mat. Now I've just got a little blanket here folded up. I find it's really comfy under the head because that way the neck is in line with the rest of the back. If you're struggling with back pain, the last thing you want to do is end up with that head kind of there or there. You want to feel that length. And then we're going to take one foot out. Now at this point, I'm going to bring my arm underneath the cushion. My head is resting down. And this is where the magic happens. So I'm going to bring my hand like a kind of C shape on the top of my hip, pick the leg up, and I'm going to press that leg away and bring that hip back underneath my rib. So I press the leg away and I bring that hip back underneath my rib. So I'm going to come on out and back in. If I were with you, or in my classes, what I do tend to do, obviously if it's all right with you, is just pull that leg gently. So you get the idea that you create space here, and then as you come back in again, that hip comes up underneath the rib. Then take this foot back down to the floor, slide it round in front of you, so the knee comes onto the floor in front of you, and just allow that lower back to stretch. And if this feels good,
You could do this off the end of a sofa or your bed so the knee comes down further and you get that nice stretch in the back of the hip. And then keeping it simple, just squeeze those thighs together. We're going to come back up to seated. Bring your thighs together to move over to the other side. So we'll always keep those thighs together just for making sure that pelvis is stable and secure. And we'll squeeze the thighs together, bring this leg out to the other side. Bring your hand onto your hip, pick that leg up, slide the leg away and bring that leg back in. Now, if you do find that picking that leg up is too much on the pelvis, you can do this with a ball or a cushion or a piece of paper. Cushion's probably better because it's slightly higher up. And that way you're sliding the cushion out and in rather than relying on that leg to hold you up. So you come out and you come back in and you're going to come out and you come back in with that leg. And then just as we did before, bring your knee down on the floor, just allowing that lower back to release. And again from this one, if you wanted more, you could do this off the edge of a sofa. So what we've done here, we've done the rounding of the back, we've done the twist and the sideways movement. We've got down onto the floor, we've got some space into those hips, and then we've added that stretch across the lower back. The other thing, if you're struggling with lower back pain, do try and keep moving and do try and keep walking. If you stiffen it up, you'll tend to find that's when it feels worse. So perhaps try these little stretches at the end of the day or after you've been for a walk, definitely at the end of the day before you go to bed, and hopefully you'll find some of that back pain just eases off a little bit. If it really isn't great, do go and see a specialist physio, go to your GP and say you're really struggling with it, because you just want to get it checked out if it's something that's just beyond regular dull aches during pregnancy. And if you've got any questions, just drop them in the comments below. Drop me an email, info@fit-school.co.uk. I'm Karen and I would just love to hear from you. I'm a human being and I want to do what I can to help you out. You take care.